Joining us on the line, Dr. Mustafa Hirji, the Medical Officer of Health for the Niagara region. Looking at the Niagara region's COVID-19 website right now, Doctor, still saying only 4 cases in Niagara and still saying no community transmission. Can you confirm that that's the state we are in as of our taping of this segment?
That's correct. We still only have 4 cases that have been confirmed so far. Of course, we have lots and lots of testing going on right now in the province. We also know that there are people who got back fairly recently from travel, particularly with the March break ending. So we're certainly expecting to have more cases linked to travel in the near future. As well, we do know that there are pockets of local transmission starting to emerge elsewhere in Ontario. And given patterns of travel across Ontario, we do expect that we may see some local transmission in the near future here as well.
We spoke to someone who did travel from another country, and I asked about the process when he returned. There is no check-in kind of system for these travelers. They don't have to report to public health and say, I was traveling to this country and I'm back as of this day, and confirm that their 14-day quarantine is going to take place?
That's correct. There isn't any kind of formal check-in process, just given the enormous number of people who have international travel and the enormous workload right now in public health, that there's really no way anybody could do that follow-up. So at the airport or at the border crossing, there will be a quarantine officer who does give a handout and explain the need for isolating for 14 days to these individuals. And from there, it's unfortunately a bit of a honor system that people are going to do the responsible thing and protect everybody else from anything that they might be carrying back in terms of infection.
Dr. Hirji, you talked about workload. Tell us a little bit about the public health workload here in Niagara. I understand phones are ringing off the hook. You're receiving all kinds of emails, all kinds of other people reaching out through various different means. How has public health been handling that volume?
Yeah, absolutely. So we've definitely had an enormous number of calls from members of the public who just want to understand the situation better, want to understand the risk and what they should do to prevent themselves, but also people who have traveled, have developed symptoms, are worried that they might have COVID-19 and looking for guidance of what they should do they need to get tested, etc. So we are actually been fielding on the order of, I think last week we answered about 3,500 calls or so. We had about 300 or 400 live chats we did as well. That's something that we only started in midweek, so we'll probably have more of them this coming week, and really just answering all of those questions. Unfortunately, that has required us to reallocate some of our public health staff from other programming work that we do. So things like our school health program, a lot of the programming that we do for parents to support new families, to address chronic diseases, that kind of work, a lot of it has had to be reallocated towards answering these calls and the general work around COVID-19.
There's a lot of talk online, and especially in social media, about the heroism of those frontline workers who are in the hospital, who are dealing with the COVID crisis right on the floor. What can you say about their efforts?
No, it's absolutely true. Our department includes our emergency medical service, and I think, they show a lot of courage and a lot of dedication coming every day, seeing people who might have COVID-19. They, of course, are very diligent about their infection prevention and control precautions to make sure that they're safe, and it's, a real credit to our, healthcare providers in Niagara that they're continuing to do that. And, I think this is true for really everybody who's continuing to go out and do the important work that needs to continue happening in our society, be it, healthcare providers, people in public health, people even, working in our grocery stores, etc. Everybody, I think, is really pulling together to make sure things keep working.
Are we any closer to being able to test people on a wider basis?
The province is leading testing, and they're expanding those capabilities all the time. Looking at the provincial numbers on testing, it has gone up many times over in just the last week, the amount of testing they have. So there's a huge effort to get that done. Really, the biggest challenge that we face in doing more testing is because we don't have enough swabs for testing because the entire world is trying to ramp up testing at the same time. And so the manufacturing and production of swabs just can't keep up with the demand of the entire world seeking these out. So,
we have 2 assessment centers open in the Niagara area, one in St. Catharines, one in Niagara Falls. But would you recommend that before anyone thinks about, being assessed, that they do the self-assessment tool on the Niagara Region's website? And then after that, what would the process be to be tested?
Absolutely. So start off with that self-assessment tool that we link to on our website, but it's actually a provincial tool, and that can be the first step. If you come out positive in that tool or you still have concerns, the next step is to call your healthcare provider or to call us in public health. And over the phone, we can do a more detailed assessment and really assess what your risk might be. From that point, a decision will be made if you need to go on to being tested, and that testing could actually happen in a primary care office, or it could mean that there's a referral to the assessment center. The big thing that I would tell people, though, is do not go visit your healthcare provider. You absolutely should call ahead because we want to make sure that anybody else who's in the office isn't going to get infected so they can prepare and schedule an appointment. And likewise, don't call or go to the assessment center directly. The process for the assessment center is that we in public health actually need to refer everybody to them and schedule their appointment.
Thank you very much for the clarification and the update today, Dr. Hirji. All the best.
Thank you very much.